Small, close-knit villages, country roads, forest and farmland. Vermont's identity is built around its rural character. But that same landscape makes accessing health care a daily struggle for rural Vermonters. We're talking all about it with a policy expert today on Across the Fence. Hello, Vermont. You probably know, I'm sure you know, that every year Americans celebrate Thanksgiving on the fourth Thursday of November. But did you know that the third Thursday of November, that's this Thursday, November 20th, is designated as National Rural Health Day? It seems fitting the two would be tied together, since our national abundance flows from our rural communities. Better health care is the least of what we owe to the 61 million living in rural America. My guest today grew up in rural Maine and has dedicated her professional life to studying the impacts of healthcare policy on rural health. Erika Ziller is an associate professor of medicine with UVM's Larner College of Medicine and the director of Larner's Health Services Research Center. With her Maine roots, she's also the director of the Northeast Rural Health Research Center, a partnership between Larner and the Maine Rural Health Research Center at the University of Southern Maine. Dr. Ziller, welcome.
Thank you, Amy. I'm delighted to be here.
Well, I am very excited to have you here today, and I'm really looking forward to this conversation. There's a lot to unpack about the situation facing our folks living in rural communities. And if it's okay, can we start with your own experience? Because your experience illustrates so well something that I think is really challenging, which is that connection between finances and healthcare when we're talking about our rural communities.
Sure. So my husband and I both grew up in small town rural Maine and in Oxford County, which is a little bit like the Northeast Kingdom in terms of its economy and a lot of the health challenges that it faces. And after going to college, I came back there. We returned to there to work. I worked for a small nonprofit. My husband was self-employed as a carpenter. And we started a family, and I decided to work part-time, and we found ourselves facing this huge challenge around health insurance coverage. So I could get coverage through my work, but as a part-time employee, I could not afford the premium. A huge gap. It was, more than the rent on a 3-bedroom log cabin that we were paying.
Right.
And my husband, as a self-employed professional, as so many people are, just couldn't get it, obviously, on the marketplace. And at the time, we fell into what they call the GAP group, which is this income range where you don't qualify for Medicaid. You make too much, but private insurance is just unaffordable. And this was before the Children's Health Insurance program was passed
CHIP
in
program,
CHIP,
right?
In 1997. And so my son and I and my husband, we all went uninsured for 5 years. And the experience of that, like the visceral decision making that you have to make when your kid bumps their head, can I patch this up with a butterfly strip, or do I have to take him to the ED? I wouldn't wish that on any family, and it's really motivated so much of what I do in my research.
And I think in your professional career.
Absolutely.
Because you even went back to school after that, right? Because you decided this was something you needed to do something about. You wanted to participate.
Absolutely. I was, in working in social work, and because of my own lived experience, I realized that so many of the things that were making it hard for rural people to be healthy were policy driven. And so I went to graduate school and for my PhD, and for both of those activities, my theses were focused on the Children's Health Insurance Program, and in particular, how beneficial that was for rural health.
Yeah. Well, okay, so then that reminds me of some things that we've been reading a lot about in the news right now, which is that access, particularly to facilities that are serving women and children in rural communities here in Vermont, that's something that is under a lot of pressure right now. We had the local birthing center in Lemoyne County is recently closed, which means no more pre or postnatal care. Rutland Regional Medical Center is no longer offering inpatient pediatric care. So the situation is really tough if you are a parent in particular. I mean, it's tough for everyone, but parents in particular in rural communities.
Yeah, and I think that's especially true if your children have any unique healthcare needs. So rural places, they struggle with finding enough primary care providers, but it's particularly on the specialty care realm that they really face challenges in accessing care. And what we're seeing in terms of the birthing centers and the children's pediatric inpatient is part of what is happening across the national scene.
Yeah.
Birthing centers are closing everywhere. Many rural counties have seen a complete loss of the ability to deliver a baby. And there are women who have to travel an hour and a half to get prenatal care in some rural places in the country. So it's definitely a challenge.
Yeah, and on the hospital side, it's a funding problem? It's the issue with keeping staff? What's the problem? Like, why is it so hard to keep these open? I mean, it's funny, there's a part of me that feels like we need to have a place to birth babies. We need a place for children to go and get health care. It seems like it should be a no-brainer to keep them open because they're so necessary to the community. So then what's the tension? What's the reason why?
So there is, it's complicated. And there are a number of different upstream factors that are affecting this. So first, when you're delivering care in a rural setting, your volume is smaller. Often the population that you are serving is older or more likely to be uninsured or underinsured. And rural hospitals in particular rely very heavily on Medicare and Medicaid, which tend to not pay as well as private insurance. So there's a lot of demand on rural healthcare systems, and at the same time reimbursement is not as generous. And providing so in health economics we talk about sort of fixed and marginal costs. Just keeping your building open and having enough basic staff to deliver service is a fixed cost. In an urban setting, you can spread that across a lot of patients. In a rural place, you just can't. It becomes it's hard.
Yeah.
And even things that are affecting rural families, like higher utility costs in rural areas, are also affecting our rural providers.
Okay, so it's a
perfect
domino
storm.
effect, a perfect storm, a domino effect. Yes,
Yes,
all of the things where we think of all of the different factors. So all of the different things that are hard about life in a rural community where you are slightly more isolated, less access to services in general, and then it's just compounded when you get into the healthcare environment.
Absolutely. And rural facilities struggle a lot with workforce as well because it's just harder to find people with the skill set that you need in a rural community if you don't have a college there that's training them or other
and
resources.
Things like federally qualified healthcare clinics.
Yep.
Are they accessible in rural communities, or is that something that, because I think a lot of your research is focused on these urban-rural divides. So things that we take for granted in urban settings are just not as accessible in rural communities.
It really does depend on the state, and it's very situational. So for me, when I was uninsured, there was not a federally qualified health center nearby, and that would have made all the difference. And my family, we ultimately moved to Portland, Maine, in our uninsured trajectory there, and got amazing services from the federally qualified health center. I understand that in Vermont that there is a more robust network in our rural spaces, and that helps a lot. It's still not the place where you're going to go deliver your baby, so it can be.
Well, let's talk about some of the things. So now we've outlined the problem. Let's talk about some of the things that, for example, like Larner College is doing to help improve access.
Okay. I have to say that coming from Maine, after working at the University of Southern Maine for 20 plus years, I didn't think I would ever leave. I felt like I was going to retire there. And then when the opportunity to join Larner came along, I started researching what it does in terms of rural, because that's really my passion and where I want to be focused. And it was a big part of why I was able to make the leap and come here and join this wonderful community. So starting with my center, I, as you noted in my introduction, direct the Northeast Rural Health Research Center, which is a collaboration between UVM and my former colleagues at the Maine Rural Health Research Center. And the focus of the work we do is to examine national data and monitor policy both at the federal and state level, and try to figure out how these policies are likely to affect rural people, rural communities, and rural health systems. So that's us, and we are doing that. Within the educational side of Larner, they have devoted resources and energy into creating a new program director around rural medical education. And you know, this is a commitment.
So this is that provider problem.
Yeah,
yes, and
absolutely.
about getting staff and trying to think about how do we get the right people into communities in order to be able to deliver care.
Exactly.
Okay.
And so with this commitment, they're working to refine their curriculum to make sure that the physicians they are training are equipped to go out and to do practice in rural places effectively.
Are prepared to make a difference in rural communities like in Vermont, across Vermont.
Exactly.
Yeah. Oh, that's fantastic. And then, and how is that? I mean, if you could give, you know, you could talk directly to, say, the new class of students at UVM Medical School. What would you say? Based on your own experience.
Yeah. So I would say we're celebrating National Rural Health Day today when this is airing. And the tagline, the theme of the day is the power of rural. Let's celebrate the power of rural. And I would say to anybody graduating from medical school, really consider rural practice. It is challenging. In some ways, it can be isolating and at times overwhelming. So I would definitely encourage you to make sure you have backups and supports.
But it's also impactful, rewarding, and something, again, like I said, it's something that we, considering how much we get from our rural communities, something that we owe back to our rural communities to make sure their health care. I think that's about all we have time for. Thank you so much. I really appreciated this conversation. This has been wonderful. Thank you.
All right.
And as always, Vermont, thank you for learning and exploring with me today, and thanks to the team that makes Across the Fence possible. I'm Amy Finley. This is Across the Fence. Come back and let's learn and explore again tomorrow.